Mukwenda mukunanga, mukwenda mukunanga, kine mukwenda mukunanga, mambo marukiro kumusanga, mambo marukiro kumusanga, mukwenda mukunanga, mukwenda mukunanga, ya mukwenda mukunanga, mambo marukiro kumusanga. Mambo marukiro kumusanga, batana bansoro, bantanga batumbuka, batana bansoro, bantanga batumbuka, batana bansoro, bantanga banyima, batana bansoro, bantanga banyima, kwenu kwenu, kwenu kwenu, kwakumaka kwenu, kwakumaka kwenu. Kwenu, 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 kwakumaka kwenu, kwakumaka kwenu, kine mukwenda mukunanga, mukwenda mukunanga, ya mukwenda mukunanga, mambo marukiro kumusanga, mambo marukiro kumusanga. Mambo marukiro kumusanga, mambo marukiro kumusanga.
Good evening, Zambia. Good morning, good afternoon, depending on where you are this evening. Welcome to a special presentation of TV Wakwetu, and I'm your host this evening, Frank Saliki. I'm joined this evening by Dr. Ali Kinkoma, who's a consultant pediatrician here in the UK. Good evening, Dr. Nkoma. You're muted.
Good evening, Frank.
Thank you so much for joining us. Thank you so much for taking your time to join me this evening after the news that we have just heard. When the pandemic began, feels a long time ago now. That's March 2020. We thought it was going to be something that is just going to come and it's going to go and it's going to disappear. But it has gone on for a long, long time. And as we've heard today, the more restrictions, yet the UK has pressed more travel restrictions to the Southern African countries, which also includes Zambia. And over the last, what we have seen, Dr. Nkoma, is the mutation of the virus. And it would be very good if you were able to explain that in just in a way that everyone can understand what it means for a virus to mutate and why the virus mutates.
Thank you, Frank. So I'll just correct what I do. My name is Alec Nkoma. I'm a consultant physician. I'm a gastroenterologist and hepatologist. So I look after people with disease of the digestive system and the liver. So yes, we have received this information this week that there is a mutant virus coming from our sub-region. It was first detected, I think, in Botswana, but more of that has been picked up in South Africa. A few other countries have had it, including Israel, I think the Netherlands, and in the UK, we've got 2 cases so far. So what is this mutation? It's called a B1.1.529. It's been given a nickname, like we've had alpha, beta, and Delta, and now we've got Omicron. So what does this mean that we've got this mutant virus? We are basically dealing with a very unknown enemy. So it is the same virus that we've had since the past 18 months or more. But what is expected of this virus, because it's called an RNA virus, is that when it infects a population, the structure of the virus, that the what we call the nucleic acid, which makes the structure of the virus, including its ability to infect the host, in this case human beings, tends to change because the virus infects a human being. It does get into the human body's cells, and then it hijacks the human body cells to reproduce itself. In the process of reproducing itself, the virus makes some mistakes. So because this is what we call a single-stranded RNA virus, it lacks the capability to correct itself. Just like, if those mistakes can happen in the human body. But the human body is going to correct itself because it's got an ability to proofread and redesign that virus so that we don't get many mistakes. So this particular virus, like the flu virus, has got a tendency to make those mistakes, and those mistakes in the sequence of the virus cannot get corrected. So when this virus has infected somebody, obviously those viruses which are formed, which have got mistakes in them, obviously happen within a person who has, is developing an immune system to it. So if those mistakes, those viruses which have got mistakes, escape that human being's immune system, and they get to the airways of somebody, or in the sputum, or in the air they are breathing, and they pass it on to someone else, it will mean that the person they've given it to will carry that virus with a mistake. So this virus, which has been detected in our sub-region, we don't know where it came from. It's just that we've got scientists in South Africa, and probably the one in Botswana was detected with the scientists in Hong Kong. They just probably are smarter scientists, and they've helped the world to pick up this virus for the benefit of all of us. Now that we know that this virus exists, we will develop testing systems to test for the rest of the world to see how much of this virus is already in different places. Now, the implication of having this virus with a number of mutations is that they're saying, at least from what is predicted from the lab, is that, one, this virus can stick to a human cell more firmly, and therefore that means that it is more transmissible. They also suspect that this virus, as it gets, into a human cell to reproduce itself, usually our bodies have got an ability to get rid of it within the cell before you can reproduce it to pass it to someone else using the interferon system. They think that this virus can resist that aspect of it, and therefore it will be more transmissible. And with the doubling time that they've noticed over the past week in Johannesburg, in Gauteng, they think that it is a virus that will spread more quickly. So far, obviously, we've had it only for a week. And in Johannesburg, from the reports we're getting, that it's only causing a mild illness.
And is it? I've read a report somewhere that says in a lot of people that they have seen, they're not showing any symptoms whatsoever of the virus.
Indeed, if you're doing contact tracing, even from the original virus, a lot of people would not have symptoms for the coronavirus. So in that aspect, it is not unusual. And obviously, we don't know how many of those people have had an infection previously with the earlier variants, and how many of those people have had, vaccination. So under those circumstances, if someone has survived the first virus, would expect that the illness they would get from this virus will be milder. And we also know that with the initial vaccine was developed for the earlier version of the virus, but we've had alpha, beta, and delta variants. We know that with that vaccine being given to people, it tends to mitigate the length of illness and the seriousness of the disease. So whether it's going to overcome the effects of the vaccines, we are yet to know, because obviously we're just knowing about it.
Then it brings up another question there. You just mentioned vaccines, and I've noticed a trend. We're looking at the trends. New variants seem to be coming from places where there's a reluctance or low uptake in vaccines. What are the correlations that goes with that, with new mutations and the lack of vaccines?
So the theory is that if you do not have a lot of people vaccinated, you get more people getting infected in that area. And the more people get infected, the higher the risk that someone will pass a virus which has got these mistakes in its formation that can overcome the immune system. And therefore, there is that risk. However, that is not entirely correct, because we know that as the immune system fades from the vaccinations, we've seen spikes of infections in different parts of the world, including Europe, America, and the first country to have had a mass vaccination program was Israel. They are basically in a different outbreak at the moment. So you can still get infected and you can still transmit the virus. And while the virus is transmitting in a population, you can get these mutations developing. And as I said earlier, we don't know where this mutation came from. It just happens that the scientists in our sub-regions have picked up.
So that's an interesting one. So we really don't know. I think we've seen travel restrictions for Southern African countries, but we really do not have an idea where it really comes from. It's just because scientists there have picked it up.
That is correct, and I think this is done out of precaution, because we know that with the Delta virus, which spread like wildfire across the world, which came mainly from India, that's where they detected it, and it was a massive outbreak. If you do get a virus which can transmit very easily and make people very ill, you need to take those precautions, because you tend to overwhelm the healthcare systems. So if you've got 10 coronavirus patients, it's easier to look after them than if you've got 100 patients. So I think it's a precaution that is welcome. We'll be wiser in the coming 2 weeks to see what this virus can do to populations, and obviously, and how much of it is already in the rest of the world.
And then the other question again is just staying on the vaccine. So with a lot of people, some people have been asking, does it mean if I get vaccines, I can never have COVID?
That is not correct. So if what we are seeing in the UK, obviously, that people are getting infected even after vaccinations. We also know that people who had a past infection can also get reinfected with the different variants of this virus. The question really is, what is the benefit of vaccination? The benefit of vaccination really, as we've understood now, is that, while we've got a huge outbreak in the UK, we're not seeing as many people getting admitted. There are a lot of people being admitted, but not like in the first and third wave. So we are not seeing that at the moment.
So there's been a lot less.
Yes.
A lot less hospitalization than in the first wave.
And for the majority of people who get it, it tends to be a short-term illness and they recover very quickly. So, and laboratory studies also confirm that, you do get a very high spike of the virus, but that virus goes down very quickly. So that is a benefit of vaccination. And this does make a lot of sense because the design of these vaccines was for the first variant. So they cannot completely protect us from the mutations that occur, or the mutant viruses that arise. Although what people tend to measure antibodies, there are other aspects of the immune system that are not routinely measured, which tend to kick in and get rid of the virus, and that's why that elimination tends to be quicker and less of an illness in people who get vaccinated.
I guess it's almost like what happens to a flu jab. I'm sure you do. I have a flu jab every year because
Yes.
there's a very different variants of that flu every year. Hence, you've got to have different flu jab that matches up with that variant at that particular time of the year.
To an extent, that is correct. That every year, the labs they do collect different strains of the virus from what circulates in the previous year, and then they grow that virus and then must administer that to the population, because obviously it tends to be a similar virus that causes problems. The problem we have obviously is that we've not been able to produce second or third generation vaccines with the technology that we have. So we're still using the first lot of vaccines to alpha, beta, and delta virus. So in terms of the efficacy to protect against those viruses, it's not as good as the first one. But because of the T-cell immune system that develops, we have some form of protection against severe immunity. Now, other people argue that if you do get a second dose or a booster, it tends to increase the amount. So what happens, the reason why the immunity goes down, that your body obviously down regulates or reduces the amount of antibodies circulating in your system. There is an inbuilt system for it. So if you do get a booster, you get the antibodies going up. So if you've got more antibodies in the system, that tends to stop the virus developing. But what we would expect is that those will go down again. You would be susceptible to another infection. But because your body will remember that I've been exposed to a similar type virus, then your body will be able to fight that more effectively. So that's the benefit of vaccination. But we do not have second, third generation vaccines because we're now getting into the fourth generation coronavirus. So we have to, obviously, I don't do that kind of science, but colleagues who are into vaccine technology have got to think of producing, fourth generation vaccines, or indeed we need to go back to the drawing board to see how we can get probably circulating viruses, weaken them. There is a vaccine which has been licensed from the UK about 2 months ago, which is a live virus vaccine that might be a lot easier to produce than the ones that we've been using.
So so I've had a booster vaccines, but would you assume, just making an assumption, probably we don't know the actual answer to this, would you, in your experience, would you assume there probably might be a thing with the way the vaccine, the virus, how strong it is, that there might be a thing that we might actually need to have booster vaccines every year or every other year to keep up with what the virus is going to be doing, as we do with the flu?
So this virus, we've got to accept that it has come to stay. So if this virus has come to stay, I think we'll need vaccines every year, or unless if you've had this infection for 2 or 3 times, that your body's ability to deal with it will be much quicker. So if it is just a mild illness, you may not need a vaccine in 2 or 3 years' time. But for the foreseeable, future, I think the reality is that we will need vaccines to mitigate the spread of this virus. We would expect that for those people who have had infections in the past, or those who have had vaccinations, but most so those who have had infections, that the illness might be milder. But obviously, this is just what I'm thinking. I might be wrong. We don't know what is around the corner. But this is what is natural for viral infections. And that's why the flu virus is not killing as many people now as it did 100 years ago, because over the years, we've been exposed to it several times, that our bodies have learned how to deal with it, even if we get it. So it does kill people who have got, a weak immune system, more especially the people with, comorbidities and the elderly.
Then it brings up another question, and thank you for that. It brings up a very important question. So if we've got a virus this day, how important is it for a health system to be able to manage that? Because not only are they going to be managing the usual stuff, the usual elements that they manage, now how important is it for them to almost come up with a new plan? Because now you need to incorporate this new thing for the next 3, 4, 5 years, however long it's going to be around.
Yeah, so our healthcare systems have got to adapt. And I think our government has got to start investing properly in healthcare systems. One of that is to expand basic medical care. And obviously, we need to train healthcare workers in the community on how to deal with this infection. There are simple things like, how we can prevent transmission of infection in the community, so we do not overload our hospitals. So people have got to start masking up. They've got to start washing their hands again. But people have got to be isolated if they've got an infection. They've got to understand that that is very important. And obviously, they need to minimize unnecessary travel, because it's usually the numbers of infected people that overwhelm our healthcare systems. And then we need to equip our referral centers, or we need to do basic labs, and we need to equip our intensive care units, both with machinery and trained staff. So that needs to be a priority. I don't think we've done that well in the past 3 outbreaks. So we need to do better in that. We are learning all the time, even from this side of the world, but we are able to deliver some services, albeit with challenges that COVID has brought.
Thank you very much. We are joined with our resident pharmacist, Jerome. Jerome, good evening, my friend. How are you?
Good evening. I hope I'm audible enough. It looks like I'm having some challenges with the internet. Yeah, and good evening, Dr. Nkoma. Yeah.
Good evening, Jerome.
Yeah. Frank, it has been long. Yeah.
So the question now, we're going to come out to another question. So there's been in terms of vaccinations, I think Jerome, you're quite passionate about this. You're saying everybody has to be vaccinated. So Dr. Nkoma, what would you think would be a great strategy in terms of stopping the spread of the virus in a country where so many people are not vaccinated, and so many people are self-employed, and there's no other government support that goes with that for them not working?
Yeah, so we need to convince our citizens. Obviously, we've got to work with people who need to get these vaccines. We need to have a mass vaccination program in Zambia. There's a lot of misinformation, obviously, but if you force people to get vaccines, sometimes people, tend to resist, why you're forcing this. We need to get the information there that if you do get vaccinated, you are unlikely to become seriously ill with the virus, and that you're unlikely to die. In the short term, it does stop you transmitting the virus. But we know that in the longer term, as your immune system, which you acquire from this vaccination, wanes or goes down, you lose that ability not to get infected and to transmit the virus. So we need to have these facts given to our people. So the assumption, obviously, from different parts of the world is that, if you do get vaccinated, you cannot transmit this infection. That is not correct. But the fact really is that if you do vaccinate people, you minimize the risk of them getting very ill and dying. So unfortunately, we've lost a lot of our citizens already, and we can do something about it and mitigate the outcome of the possible fourth wave coming.
Jerome.
Yeah. Okay. Concerning this pandemic, but over the issue of vaccination, I tend to a little bit differ with the suggestion from Dr. Nkoma. I think that what we need to do right now is to make people get vaccinated by trying to make sure that some things the unvaccinated people should not be having access to some things and some places, so that we encourage as many people as possible to get vaccinated. As you know very well, we are in a poor country, and our healthcare system is still in a bad state. So we cannot manage if the fourth wave is as bad as you saw what happened to the third wave, where people were dying like something that you cannot manage, something that you cannot imagine. So in terms of vaccination, we are supposed to go with the mandatory vaccination for all the frontliner health workers. Imagine in especially in the country which has a ratio of one doctor to about 22,000 people, one pharmacist to about 30,000 people, one nurse to about 11,000 people. And these people whom we are talking about are also not yet vaccinated. Now, how are they going to fight the pandemic if this fourth wave is as bad? So that's the dilemma we have found ourselves. No wonder, for me, I feel when the president was launching the COVID vaccination, we were supposed to the president to mention some mandatory measure of way of vaccination. Currently, South Africa is not very much worried with with the new variant that they have found, because they are saying most of their people, about 30% to 40%, are vaccinated. Well, in Zambia, we only have about 8% of the people who are vaccinated. That's a big challenge that we have, and we have no option but just to go on the mandatory way for us to let and have the numbers of people increase in terms of vaccination.
Then I'm going to ask another question. Dr. Nkoma, if it comes to information, how important is information in this period, especially when people have got so much information on what's going on with the vaccines? How important is it the Ministry of Health, whoever is in charge produces the right information, and that information goes to the local language so that people don't say Wanamlenga Pakona said this and this about the vaccine, so that the information comes from the right people.
Yeah, so that is very important that we get this message to our communities, and the message has got to be simple, and the community health workers can deliver that information to the community. And the message should be that we need to vaccinate as many people as we can. Following the third wave, I think we had a lot of Zambians queuing up to get the vaccine because I saw the number of people that died from coronavirus. And I think, people do understand that this virus is killing people. Obviously, there's a lot of misinformation, which is coming from different sectors. And that misinformation obviously does not, do well for our country because of, how much information people can access and read and the scientific understanding of these facts. So we have almost 99% of healthcare workers vaccinated in the UK. So none of us have got, chronic problems or we are dead because of the vaccine. Okay. And what we have seen, obviously, is that, the right information is that what we need to understand, and every healthcare worker and those who are doing the vaccine campaign, is that the vaccine protects you from passing or getting infected and passing this virus to another person only to an extent. Those people who have had this infection in the past are as good as those who have been vaccinated. So those facts, governments across the world have not made very clear to the populations. They are vulnerable populations, and those include the elderly, people with diabetes, people who are overweight and other comorbidities. In Zambia, we have seen much younger people die from this coronavirus infection. So for us to mitigate the outcome of this virus, we need to vaccinate as many people as possible. And with any vaccination program or any medical treatment, I come from a huge family of physicians. I mean, my club is called the Royal College of Physicians. The UK government has taken a step in a line that all health workers should be vaccinated by a certain time. Certainly, they've done that to the care home workers. A lot of care home workers again have left the care workforce, and therefore that is creating a shortage. Because of the line they've taken, there is a possibility as well that in the coming 4 months, we might lose a few healthcare workers. So the Royal College of Physicians, to which I'm a fellow, the Academy of Medical Sciences, and the Royal College of General Practitioners have said this should not be mandatory. So in medical ethics, obviously, patients or human beings have got autonomy to receive a treatment. I know that Zambia has already taken a line to, mandatory HIV testing. But if you force certain measures on people, especially when there's a lot of misinformation, a lot of people can become resistant. So we need to give people facts that if you do get vaccinated, you're unlikely to become very ill, and you are unlikely to die from this virus. And we need to have a priority of vaccinating the elderly first, and those people who have got comorbidities, people with, who are recovering from cancer, or people who are immunosuppressed. So we need to do that as a matter of priority. And then, in fact, if healthcare workers have not been vaccinated, if, they need to be vaccinated because they are looking after patients. They need to be there because if they do get an infection, they might be out for a long time, and that will create a shortage. And obviously, in the short term, if you do get a vaccine, it tends to prevent you transmitting that virus to a patient. So that we need to convince our public Obviously, I'm not sure what the Zambian government will choose to do. They might want to go, the way of the United Kingdom or the United States, where they make these things mandatory. I follow, the position of the Royal College of Physicians, and as a physician, I believe in autonomy of patients, that they can make decisions regarding their health. And if we force people to get these vaccines, and those conspiracies play in their minds, and then we create a problem. Like what is happening in Europe, people are going on the streets rioting because of all these things. So we need to depoliticize medicine, and we need to depoliticize this epidemic. We just need to deal with the facts as we're facing them. If we do not vaccinate people, a lot of people are going to die. And that is a message that, and obviously because people will die as well, because our healthcare systems are still weak to handle annual coronavirus patients. So those are the issues really that will lead to a higher mortality, like what we've experienced in the past. So that is my take on that.
Thank you. Joe, would you agree or disagree that when the vaccine was first introduced in Zambia, there wasn't a lot of information. There wasn't a lot of learned people coming up and explaining, and that we haven't seen press conferences of the chief COVID advisor to the president coming up and said, this is what we're doing. Wouldn't you agree or disagree that there just hasn't been a lot of information to the powers to be to inform the people about the vaccines?
Yeah, you see, in terms of vaccines, I think people right now, they have a lot of information. But one thing that we need to know very well is there a lot of information on what is happening in Zambia concerning the virus. In terms of currently, we don't know which virus is more predominant in Zambia as compared to the other virus, because of the issues of us not doing some things like genomic sequencing and all that. So whatever which we are trying to do, we are just trying to learn from what other people or what's happening in other countries. That for me is very much unfortunate, and it's something that we need to invest more money in terms of the equipment, and also to promote our biomedical scientists to make sure that they do the genomic sequencing and all that are very simple to be done. But due to lack of equipment, it is finding to be very difficult. Currently, we cannot be told, and we have never been told, the more predominant or the more dominant a type of the virus that we have, according to the number of cases that we have. If today we will go to Ministry of Health and ask them to say, you have mentioned that we have about 200,000 cases. Can you tell the nation about which of these viruses was bad to the people, and how many of the people had each virus? You'll find that it will be very, very difficult. That's the unfortunate side of it. Coming to the other question that you said, I think, to be honest, today I don't want to be in a capitalism kind of, but today I want to be as much professional as possible. For me, I feel the position of the presidential advisor for COVID, I think it has brought kind of some kind of confusion, kind of in terms of the way we are managing the pandemic, and it is very difficult in the way that the way the reporting is supposed to be done. It's like the presidential advisor for COVID is just one person. Then all the entire people are feeding in the mainstream of the Ministry of Health. But now these people, they get instruction from their permanent secretary, and the permanent secretary gets information and instruction from the minister, and they do advise the minister. Well, there is also a presidential advisor who's higher than the minister, but is just a wrong person, and they need to get information from this person who needs to give who's the advice in terms of COVID. So now people are trying to ask to say, what do we need to follow? So there is that kind of inertia, and there's just kind of communication problem with the what step do we need to follow, because people are waiting to hear from the presidential advisor on COVID, and they are failing to do and execute the duties the way they are supposed to be executing. Because if you think very well, we had a good institution that we are learning in terms of COVID. We are Zambia National Public Health Institute. We had also Ministry of Health, and these are all under Ministry of Health, and the command was coming in one line, then they go to the head of state. But this time now we have three, where we are getting the command in terms of the vaccination, the COVID issues, and all that. That brings a lot of confusion and inertia, and it itself delays the way the action are supposed to be taken when they need to be taken. For example, we are talking about the issues of health workers being vaccinated. Still, there is no such information. I'm happy Dr. Nkoma mentioned to say the British government has made it clear that all health workers are supposed and need to be vaccinated. But here in Zambia, it's not like that. We are talking about the frontliner health workers in different ministries are supposed to be vaccinated. And we are seeing in other countries, the US, where there is put mandatory vaccination. We have also seen other European countries moving in terms of mandatory vaccination. But here, we don't know. On the other hand, the minister goes and they remove the restrictions for COVID. On the other hand, the presidential advisor goes and also say, no, there's no need of us being on a mandatory and all that. Well, we know very well that there are a lot of issues concerning the COVID that is going to affect the good 2022 budget that the government has put in place. And that is my main worry.
What is Dr. Nkoma? How important is it? I've just been listening to the British Prime Minister earlier on coming up with the plan of how they're going to deal with the new variants. How important is it in this time, in this difficult time, for there to be one message and one message alone?
Yeah, so it's very important that we have one message to minimize confusion. I'm not sure, obviously I'm not on the ground in Zambia on how effectively the presidential advisor and the minister are working, and the permanent secretary and the National Institute of Public Health. So it is very important that these entities work together to deliver the same message. So when we need to have one message, we need to put resources together, and then we need to streamline our priorities.
So the other question I have. So we've been planning about the fourth wave. Dr. Koma, you and me have been involved in something, and we've been talking about this fourth wave will be coming. And Jerome, you are in Zambia, so how prepared is Zambia for the fourth wave?
Yeah, you see, Frank, the way I've said that there is a vacuum in terms of communication. That's the main information that is here on the ground. I don't know if we are well prepared in terms of the fourth wave. Just like I've said, we have only vaccinated 8% of the people, and there's serious inertia in terms of the people getting vaccination. On the other hand, we have removed the restrictions that we had to put across in terms of the of COVID. So there is all that, and it's like a job as usual. And with this new variant that has been detected, I think there's no much communication in whatever which is happening today on ZMBC News. I was listening to the minister saying that the people in the vaccination center, they should start working 24 hours 7. But look, it's not about the people working 24 hours. And she also today in the statement mentioned to say you should start vaccinating anyone, whoever comes, you need to vaccinate. If you open one valve there's only one person who has come in to vaccinate that person. That's another challenge that's supposed to be there. The problem that we have is not the shortage of vaccines. That's not a problem. The shortage of vaccines, we are not there. We have enough vaccines. But the problem that is there is shortage of people who are supposed to be vaccinated. And people have been given enough time to make their own decision that they have failed to make. So in this situation, we need to be more proactive in doing these things. Why should the health workers be vaccinated 24 hours service? Well, we know very well that there will be no one to go to get vaccinated. Why should we start wasting the vaccines by just making sure that one person comes, you open a valve, you vaccinate one person, then another person comes after 6 hours, meaning that the 9 doses, you need to dispose them off. That is wasting. And these resources are coming from the donors. And these people who are buying us these vaccines are buying these vaccines at a very expensive price. So we cannot be such reckless by us saying, even if it's 2 people come vaccinate them, open the valve. That's reckless in doing such kind of things. We are not supposed to encourage that, but we can use technology and allow people to book for their vaccination in terms of when they want to be vaccinated. And moreover, besides that, we have not yet started the booster doses here in Zambia. Myself, I think I got my vaccination. This is my 4th month, and I'm waiting for it to reach 6 months somewhere there. I need to go back for my booster dose. But what about those people who got the first, who are earlier than me, who have now reached 6 months? They need to get their booster doses. We have not yet started that, and we have not yet started in terms of vaccinating the school-going children, age 12 years going up. We have not yet done that. For your children who are 5 years to 11, we have not yet have any plan concerning that. So there are all these things that we are supposed to be done. We have not yet done. We are still fighting with vaccinating the people who are 18 years and above. Why should we be fighting for that this time after all these years of vaccination? And you know very well that in January, February, there is a serious peak of the virus here in Zambia. And this is when we're expecting a serious 4th wave in Zambia.
Thank you, Jerome. It is that time where we're expecting. We don't know what is going to come in our country, and it's about time we start thinking about how we manage a position we find ourselves in. Dr. Nkoma, just imagine you were in charge of what's going on in Zambia right now. What would be your starting position? What would be the next 2 or 3 steps that you put in place?
So my starting position is to make sure that the community are properly educated. We do these things well with the radio stations when we've got cholera. We've done AIDS campaigns with posters in the community health centers and all those places. I think we've got the Janssen vaccine and the AstraZeneca vaccine, and more recently the Americans have donated the other vaccine, which logistically is a challenge to administer. You might want to keep that in the cities so that you adhere to what we call the cold chain, because they need a very low temperature for storage. Regarding the AstraZeneca vaccine and the Janssen vaccine, what needs to happen is like what they used to do in the under 5 clinics. You need to go to the villages, you need to go to the communities and vaccinate people there. So I think that's what needs to happen. You cannot just expect people to come to the health centers to pick those things with this misinformation. You might have to convert people's understanding of this problem when you visit them in their communities. So I'm glad that we do not have a shortage of vaccines, because I thought that was a problem. Certainly, if the vaccines are going to be wasted, we will be very ungrateful to those people who have donated these vaccines to us. And certainly, our people have got to understand that if you do get the coronavirus infection, it can be very serious if you've not had the vaccine before. And if you do get admitted to the hospital, you might die in hospital, especially if you are in intensive care. The ability of your coming out of intensive care in a Zambian hospital is very, very slim. It is a lonely death, and the people that are dying are the breadwinners, their mothers, fathers, uncles. We've lost a lot of these people already. We should not be losing them again if vaccines are available. So that message needs to go across. We've got a lot of misinformation that we need to deal with, but I think we need to take these vaccines into the community. So our funding has got to be channeled towards, motorcycles, vehicles that can reach remote communities, vehicles that can go through the high density areas, whether it's in Lusaka or any other town in the Copper Belt or in Central Province. So we need to go and see these people and give them the vaccine. So we cannot wait for them to come for them.
I'm just going to say, so what you're saying is, we've got the vaccine, instead of saying people come, we say, right, we got the vaccine and we're coming to you.
So these were local successful programs when I was going to school. They used to come and give us BCG vaccinations at school. So they would come and give the whole class a BCG vaccine. Yeah. And they would also visit the villages and weigh the children under a tree and vaccinate children under the tree. Those programs, which were in the 70s, 80s, and 90s, were very successful. And we don't need to reinvent the wheel. We just need to have a cooler box for Janssen and AstraZeneca vaccine, strap it on the back of a motorcycle, and then go and vaccinate people in the community. So that should work. It should not be very expensive.
That is a very good point. Let's take the vaccine to the people. People can communicate. They can ask the healthcare workers any questions that they have, so that they're not getting all these answers from. They're not getting these answers that are very important from somebody who's not qualified. Right, we've got about 5 minutes to go. Jerome, I'll ask you the same question. What will be your 3 strategies from here? You've been in Zambia, knowing what you know.
Yeah, I think my first step from here, I think will be one first is to push or to have a policy from the president where first we start with all the civil servants to get vaccinated. Yeah, that's one step I will start with. Then 2, I'll make sure that I move the vaccines from the hospitals to where the people are, in the markets, in stadiums, in bus stations, and other areas where I feel they need to get vaccinated. 3, I need to make sure that sometimes I put kind of like incentives or some kind of things for people who are vaccinated, to be like a rotary kind of, for them at least to encourage as more people as possible to get vaccinated. And 4, I'll make sure that I engage the parents to have also the children get vaccinated in schools. In that way, I think we may say we need to have the best the best outcome from the people who are whom we supposed to get vaccinated. Yeah. So in terms of the policy, this policy mainly will restrict the unvaccinated from having access to some of the services that's supposed to have, in terms of visiting the restaurants, in terms of supermarkets, in terms of crowd places, all those kind of things. In my first step as a policy to push, that's what I may push and have the president assented to that, so that at least I can have as many people as possible, because we are at the war. We are fighting a serious war here, and when you're at the war, You don't, when you are fighting a war, you don't question the soldier once they pick you from wherever you are to take you to a safe place. You don't ask them, where is my mother, where is my father? They just pick you and put you to where you are safe. So in this situation, the health workers are soldiers who are fighting this pandemic, and they definitely need to take the citizens to a safer place and a safer land. And in this situation, the safer land for our citizens is where they are supposed to be vaccinated, which is citizens they have failed to make the decision by themselves. In terms of communication and in terms of educating the people, I think a lot of work has been done in that area. If I say not much information has been done, I'll be lying. I think a lot of information has been done, and all the radio stations have been so nice and good to the government in such a way that it's almost every 30 minutes they talk about vaccines, they talk about coronavirus in different languages and in different radio stations. So we have already done that, but we just need that punch to have people get vaccinated.
Thank you. I've just been joined by Mr. David Simkonda very quickly. Good evening. What's your contribution or any questions you've got?
Good evening, brothers and sisters. My main concern is just how you are going to do it, more especially in villages. Because myself, I'm coming from the typical village. So how are you going to vaccinate these people in the villages, like the village where I'm coming from, whereby to reach the town you take maybe 10, 15 hours riding or driving. So in short, how are you going to vaccinate the village people? Thank you very much.
Jerome, do you want to pick up that one?
Okay, yeah, I think I can pick up this question. You see, when we have issues like Child Health Week, we usually travel or we go camp in these areas where we take all the needed materials, especially the vaccines, for us to vaccinate the children. So the same way we do Child Health Week, that's the same way and the same strategy we can use to vaccinate the people need to reach areas. Just like Dr. Nkoma also said that the strategies that were used in the 70s, 80s, and 90s were a success strategy. We can get the same strategy and do the same way we have been doing, though we may have one or two challenges in terms of the rains, but the rains just begin, it just started. So we can go flat out where the rain is not that bad and make sure that we vaccinate as many people as possible, as the vaccines we have, they are user friendly with our environment where we are in.
Thank you, thank you very much, Jerome. Thank you very much, everyone, for joining us. This has been a special presentation of TV Wakwetu. This came about because of the announcement that we had today. Zambia is on the red list of the UK because of new variants that is in Southern Africa. We were joined this evening by Dr. Nkoma, resident pharmacist Jerome Kanyuka, and also at the end, our David Simkonda, who just left. Also, remember, TV Bakwetu, buy some stars, support us. And also, if you want to be part of the TV Bakwetu family, you can do that for £3.45 a month. And we will welcome you, and you get to meet all the TV Bakwetu all the regular crew. Dr. Nkoma, thank you so much for taking your time to be with us this evening.
Thank you, Frank, and fellow Zambians. Let's get our citizens get vaccinated as soon as possible. We don't know what is around the corner. We need to save lives. Thank you.
Thank you very much. Jerome, one word, 30 seconds.
Yeah, I think let's all get vaccinated, and we need to push our neighbors and our relatives to get vaccinated. That's the only way out for us to fight this pandemic. Thank you.
Thank you very much. Thank you for joining us again for this special presentation of TV Wakwetu. God bless our country and be with you every single day. May our Heavenly Father always bless you, keep you, and guide you till we meet again. See you again. Bye-bye.